Hello, my name is Ruth Nelson and I hide my identity at great personal risk. This is Tedros Adhanom Ghebreyesus. He is the first Director General in the history of the World Health Organization to not be an actual doctor. In fact, he has zero medical experience. In what is nothing short of a historic showcase of corruption, Tedros has been favoring the Chinese Communist Party since the beginning of his career. I usually love curry, but this makes me sick. Tedros was born in Ethiopia where he joined his country's communist rebellion and helped topple the government in favor of the communist TPLF party, a movement known for stifling journalists and repressing minorities. In fact, the TPLF could be more accurately described as a gang of criminals, responsible for the genocide against the Somali people of the Ogaden. They were listed by the US as a terrorist organization in the 90s and their crimes against the Amhara ethnic group are worthy of jail time. As you can see, Tedros was a natural greaseball with a propensity for politics and worked his way up to become National Minister of Health for his country of Ethiopia. While serving, he drew the ire of both global health experts and his people by denying and actively stifling evidence of the three massive cholera epidemics his country endured over the course of 10 years. Truly, a dick move. However, his slimy habits appealed to China as they have praised the authoritarian development model of Ethiopia's regime, which rules under emergency powers and shuts down pro-democracy protests. Excited by the prospect of a new lapdog, the Chinese Communist Party decided to invest heavily in Tedros, supplying him funding to bolster his country's hospitals' education and research capabilities. This enabled Tedros to ascend to Ethiopian Foreign Minister, where his main accomplishment was boosting UN funding and recognition for Ethiopia. China directly ensured this by funneling their money to Ethiopia through the UN. This made Tedros look like a success, as few politicians in the history of the region have ever made such an impact, but that's not saying much. What the public didn't know at the time was that the massive balloon Tedros was riding on was inflated with Chinese cash and controlled by President Xi. The Chinese Communist Party convinced enough UN voters to elect Tedros to the role of Director General in 2017 by promising to significantly increase their funding. Tedros barely squeezed out a win, and coincidentally, Chinese funding to the World Health Organization jumped from 12 million to 18 million. His first order of business as Director General was appalling and nothing short of blatant corruption. He appointed African dictator and known human rights abuser Robert Mugabe to the post of WHO Goodwill Ambassador, a clear move to support Chinese and Russian interests. As Zimbabwe's dictator, Mugabe advocated for the poor to violently seize land from the landowners, resulting in years of famine, war, instability, disease, Chinese influence, and electoral fraud, until his own people ousted him in a coup. The decision was met with such fierce backlash from every corner of the global health community that Tedros had to rescind his offer to Mugabe the next day. Years later, we are still seeing Tedros show China preferential treatment. Tedros has made numerous statements expressing his respect and gratitude for China's response to the coronavirus pandemic, praising the regime's transparency, the speed of its response, and crediting them with preventing death both at home and overseas. But if you look at the record, you'd have to be a CCP shill to say that. The first reported case of the new coronavirus is from the Hubei province on November 17, 2019. The number rose slowly over the course of weeks until dozens were flooding the Wuhan emergency room in late December. On December 30, Chinese ophthalmologist Dr. Li Wenliang sent text messages to his colleagues warning of SARS at a Wuhan sea market 3 weeks before the city of Wuhan was placed on lockdown. These messages were posted on social media and went viral before being removed by Chinese censors. 2 days later, Wuhan police condemned Dr. Li Wenliang and the others for spreading inauthentic information without proof. Officers said their acts had brought bad impact on society, and they would be dealt with by law, according to Chinese media. On January 1, the Hubei Health Commission placed a gag order on the select gene sequencing companies that had reportedly identified SARS-CoV-2. This is more than 1 week before the first Wuhan resident died of the virus. On January 6, Chinese media reported there to be no risk of human-to-human transmission of the new SARS virus, urging life as normal for 2 full weeks until backtracking on January 20. The WHO was uncritically repeating information from the Chinese authorities, ignoring warnings from Taiwanese doctors, and reluctant to declare a public health emergency of international concern. A meeting with Beijing on January 22 convinced him that there was no need to do so. The WHO made another statement applauding China, especially the commitment from top leadership, and the transparency they have demonstrated. The WHO finally declared a public health emergency of international concern on January 30. The virus had gotten too big to ignore, and even though the virus is genetically a SARS coronavirus and causes severe acute respiratory syndrome, the World Health Organization decided to name it COVID-19. As if we didn't already know, they literally said they chose that name to avoid associating this with China for the past SARS epidemics. At this point, the virus had spread globally, but it took the WHO another 5 weeks to declare a pandemic on March 11. Once again, China used the World Health Organization as their mouthpiece, forcing the feeble Tedros into stating the country had gained invaluable time for the response in an all-of-government and all-of-society approach that has averted or delayed hundreds of thousands of cases, protecting the global community and creating a stronger first line of defense against international spread. This is all obviously false and nothing more than an attempt to broadcast CCP propaganda through the World Health Organization. The disease should have been named SARS 2020 or SARS 2019, not COVID-19. The fact that Tedros admitted to trying to reduce panic and then having the nerve to tweet in February that we have yet to see the tip of the iceberg is fucking pathetic. The Change.org petition for the resignation of Tedros Adhanom Ghebreyesus has 980,000 signees and counting. The first step to depoliticizing healthcare is to remove Tedros Adhanom Ghebreyesus from the World Health Organization and stop Chinese influence. If you liked this truth, then like and subscribe. By the name Ruth Nelson, I live and I die.